Welcome to the Voices in Health and Wellness podcast, where we explore real conversations with the practitioners, founders, and innovators who are shaping the future of care. I'm Dr. Andrew Greenland, I'm your host today, and today's episode is especially meaningful as we dive into the evolving world of mental health and neurocare, an area that's seeing rapid innovation, but also increasing demand and complexity. I'm joined by Dr. Scott West, Chief Medical Officer at Nashville Neurocare Therapy. Dr. West is a nationally recognized board-certified psychiatrist with over 30 years of experience, particularly in the treatment of clinical and treatment-resistant depression. His work sits at the intersection of traditional psychiatry and of emerging neurotherapies, helping patients access more advanced and personalized care options. So with that, Scott, I'd love to welcome you to the show and thank you so much for joining me today.
Thank you for the invitation. I'm glad to be here.
So maybe we could start at the top. Could you talk a little bit about your role and your journey into the work that you do? Because I always find that's inspiring and gives a lot of context for people that might be listening.
Sure. I finished my residency in psychiatry in the 80s and started a private practice, worked in hospitals, as well as having an outpatient practice. And at some point early in that journey, the local University, Vanderbilt, referred a student to me who had a mix of anxiety, depression, obsessive compulsive disorder. She eventually was referred to the facility in the Northeast and decompensated there, was hospitalized at Harvard. When she came back ultimately to Nashville, she told me about the research that was being done there on something called transcranial magnetic stimulation, which was quite interesting to me and as a way of non-invasively doing something in the brain to facilitate some positive clinical change. And so I paid attention to that as the research came out over years. And eventually in the early 2000s, when it was being researched with an intent to have FDA clearance, I was paying more attention. I made an assumption then that it would probably be at either academic institutions or large facilities. But when it was FDA cleared in 2008, and then I looked into it further, I found out it was an outpatient procedure. And at the time, having more than 20 years of experience, seeing people with depression, and that's what transcranial magnetic stimulation was FDA cleared for initially, I thought people get better. People do well with therapy, with medications, the first line treatments, but not everybody really gets well. And some people don't seem to respond at all. We had at that time an option of electroconvulsive therapy, but in terms of looking at less invasive opportunities to help patients improve their clinical situation and the quality of life, this seemed like something that was worth pursuing as I reviewed the literature. And so I contacted the organization and in 2009 made arrangements to begin the process of this new type of non-invasive treatment on an outpatient basis. And it started in 2010. And what we found was that a lot of people did really, really well. Most of our initial patients were patients that I knew that had been in my practice, and I knew their course of treatment and knew how aggressive the treatment had been. And so when we found those people having an improved quality of life, reduction of symptoms, thought we needed to pursue this. So over time, we expanded the clinic a bit, in doing it in one of our offices in Nashville. And as time went on, we needed to grow more. I had the opportunity with Neurocare to collaborate on that, to increase the footprint, to get more, have the treatment available to more people. And some of my colleagues around the country of the US have done that as well, and now across the globe. So it became a treatment that was working. The idea was how to make that more available to people. And one person alone has some limits with that. So collaborating seemed like the thing to do. TMS has grown to where there were a few hundred of us at the beginning, and now there are thousands of systems around the world. But neuromodulation didn't really stop there. As TMS has grown, and there are different variations of it, different parameters that can be used. So it's maturing in its own right. But now the whole world of neuromodulation is becoming something that incorporates different types of therapies, of not just activating the dorsolateral prefrontal cortex, but using different treatment modalities to activate the trigeminal, occipital nerves, transcutaneous electrical stimulation. Now we have pharmacological uses that are in the world of neuromodulation, including ketamine and esketamine. And there's, I think, opportunity for growth with many other things down the road.
Thank you. So tell us a little bit about the setup at Nashville Neurocare, and what's your role specifically there?
I am the medical director, chief medical officer. We now have several clinics around the state. Some of my colleagues in Knoxville do the medical management, direct management in that clinic. I supervise the practitioners, the physicians, the nurse practitioners that are doing either medication management or TMS. And that's my specific role. Also, as part of the group that manages it, we am involved in all sorts of discussions that have to do with the back office management decisions about human resources, about marketing, about insurance negotiations, and so forth.
And I guess your role has evolved as the practice has grown. I mean, how has it changed with time?
When I first started, it was I was the person who did everything, from going to talk to local colleagues to intakes, doing the motor threshold determination, the mapping that's essential to TMS in the beginning, sometimes doing the treatments, having all of the business decisions, because it was my business alone, didn't have anybody to bounce the ideas off of other than the occasional colleague that we could talk about things. So it's grown to be more focused on the clinical, but still having some input into the back office type of things.
Thank you. And in terms of the patients that you're seeing, the patients that you're helping at your clinic, can you give us sort of a range of the different presentations and how your approaches are doing things differently to perhaps how others are doing them?
Yes. The initial FDA indication with transcranial magnetic stimulation was for major depressive disorder that hadn't responded to medication. It has expanded over time to include anxious depression, OCD, with a different type of treatment location. And so it's been very diagnostic driven. I in many ways don't like that, because TMS is a tool that is increasing circuit activity in the brain. It's increasing plasticity. It's increasing the activity of monoamines throughout the brain. And depending on what part of the brain is particularly activated, it can do other things. There are a lot of, if you will, off-label uses for TMS, but they are off-label without an FDA indication. But there's a lot of research out there looking at it for a myriad of clinical issues. So while most of our patients do have major depressive episode, oftentimes with anxiety, and a smaller number have obsessive compulsive disorder, there's oftentimes a mix of symptomatology that we have to deal with. We're also now dealing with the possible additions of other types of therapies to use synergistically with TMS that include medication management, include psychotherapy. So it's everybody is an individual, and they come with their own issues, their own psychodynamic situation, and we're looking at what can we do with each patient to help facilitate the improvement in their clinical symptoms.
Thank you. And what are the sort of major shifts that you're seeing right now in the wider mental health world and neurocare, from your perspective?
I think the first thing that comes to mind is the greater awareness of the need for mental health services. For so many years, decades, centuries, it's been not talked about much. Now it is talked about a fair amount. More people are comfortable with it. Particularly a younger generation seem to be much more comfortable talking about it without having to be pried to get information from them. So awareness is the first thing. The other thing that comes to mind is the lack of awareness, because as much as we have made progress with people knowing about mental health issues, treatment options, there's still so many people who don't pay attention to it. And it doesn't serve our population well. We know, for example, in with employment, that about 20% of people are struggling with some type of depression. About a third of those are really struggling, and they're not doing well. They have this issue of presenteeism where they're there, but they're not fully able to function because the issues specifically with depression that have to do with motivation, persistence of activity, cognitive functioning, and efficacy aren't there. So they're not fully able to be as quality an employee as they need to be. Thus, it's causing problems to the employers. But also, when those people go home, it's not about employment, it's about their home life, their children, their family. When they're not going to the children's plays or productions at school and they're not socializing with friends, it limits their quality of life. So as much as we're talking about mental health more, we're not talking about it enough so that people implement changes in their lives that can accomplish improvement in what they're trying to do in their lives.
Thank you. I guess you're saying that there is a rise in treatment-resistant depression. That being the case, how has it impacted your approach at where you're working?
It just gives us the incentive to try to make us available to other people. We continue to try to look at clinical changes we can make in what we do, so we're providing people with optimal treatment.
And you were talking about the awareness of your approach. I mean, what is the level of awareness? I mean, do people appreciate that there are other options when the drugs aren't working?
Some people are aware of that. Others aren't, and they just stagnate. And they're kind of sort of maybe better, but not really better, but don't know what to do about it. And that includes some of my colleagues don't know what to offer them. Neuromodulation, specifically TMS, has not penetrated into the greatest awareness with therapists, clinicians, psychiatrists, and primary care doctors.
What about patient expectations? Have you noticed a change in patient expectations since you've been in practice, and what are you kind of picking up on in 2026?
Yes, patients oftentimes will want to be all better. They're looking for something that's going to make all the symptoms better. And I think we're much more complex than that. Even if we can improve symptoms, sometimes people's psychosocial situation is not optimal. They have difficulties with relationships or with work or with neighbors, and sometimes within families. And if they don't address those and learn ways of positively moving forward with life and dealing with conflict, unfortunately, the symptoms recur so often.
And you mentioned, obviously, the general increase in mental health disorders. Do you think the system is keeping up with this level of demand at the moment, the wider system?
I don't think so. I think there are efforts to do that, but it's there are not enough therapists. There are not enough psychiatrists around here, and from what I hear around our country. So I think there are efforts to try to do that, but it's a challenge.
And what do you think the solution is? I mean, how are we going to get to a situation where supply and demand are kind of matched?
Well, I don't know that there is a fix to that, but I do think that as we can encourage people to move into the areas of being therapists and being clinicians in that space, that we move toward that direction of improving that imbalance.
So thinking about your clinic as a business, because it is at the end of the day,
Mm-hmm.
what are you most proud of, and what's working really well for your practice right now?
Our people. We have put a priority on finding people who are very invested in helping others, in doing their particular job, and we cross-train people, so people are very familiar with all the aspects of what we do. But it's the personnel that we're involved with that is, I think, at the height of awareness when I think of what I'm proud about.
So the $60 million question is, how do you get good people, and how do you train them in such a way as you have such good people working for you? What's the secret sauce?
I think to the degree it's a secret sauce, it's involvement. It's clear expectations, real guidelines that make sense, and an upfront discussion with people about what those expectations are and what their strengths are, what their weaknesses are. I have an interview this afternoon with someone. One of our treaters has moved on to other things in their life, and so we're looking for somebody right now. So it's kind of top of my mind. How do you find the right people to do the best job they can?
And we talked about, what's going well, what you're proud of. What's most frustrating or challenging, or things that you've had to overcome in doing the work that you do?
There are two things. One of them I've mentioned, the lack of awareness. It's frustrating to do something that we know based on our own experience as well as the research that is very helpful to people, but so many people don't know about it, and trying to help my colleagues and the community be aware is one of the frustrations. The other one has been dealing with our insurance system, where they finally have coverage for neuromodulation techniques, TMS and esketamine, but the criteria are onerous at times. So our patients have to jump through hoops to be able to get the treatment that we think would be of help.
So the insurance seems to be a universal conversation I have with everybody working in America and all the discussions I've had. What is it about this particular technique that causes so many issues in terms of getting the reimbursement? Why is it such a treacherous journey?
Part of it in terms of reimbursement, but also patient access, was there was such a paradigm shift. Transcranial magnetic stimulation is unlike anything that's been done in our world before. So the insurance companies didn't know what to expect. And I think that has caused a lot of it. There's a concern that there would be some type of overuse, misuse, and I think we all want to guard against that, because that's a possibility. But most people with the insurance companies, at least early on specifically, just did not know what to think about using a electromagnetic current to activate the brain. That was an unusual thing for them.
As a medical director, I guess that there are some particular metrics or outcomes that you're always interested in. What are those for your clinic, and is there anything that you're most focused on trying to improve?
Response and remission rates are the number one thing. And with the original studies that were done when people were off of medicines for a long period of time, not in any type of therapy, we had remission or response rates that were over 50%. And we try to improve that as we use that mix of treatment opportunities with patients and newer type of techniques where there might be, for example, multiple treatments a day, and so forth. And we're moving up toward the 75 to 80% response rates. And that's extremely positive from our standpoint when we see our patients respond. So the focus is on the remission and response rates.
Thank you. So with the medical director hat on, I guess you do have lots of hats. And I'm just curious to know if there are any particular bottlenecks that you are having to face or deal with in the kind of the back end of the operation, not necessarily the patient facing, but all the stuff that goes on behind the scenes.
That would include, again, helping people understand that we exist. It deals with dealing with insurance companies just in, again, nothing unique to us, but that process is never easy for any of the clinicians to deal with. And personnel issues. We value our personnel, and even as we have very good people that work with us, there are always issues that come up just as we're handling all of that type of thing. And then the expectation, and this is really much more of a positive opportunity, I think, but looking forward, how can we advance what we're doing? How can we refine it? how can we add to what we're doing with new technologies and so forth. So the opportunities of progress.
And from a medical director's point of view, the chief medical officer's point of view, what's the biggest time drain for you? What takes you away from the things that you enjoy doing in your practice? That just curious to know, what are the personal time drains for you?
The administrative issues that take up most of that are going to be doing peer-to-peer conversations with insurance companies. It's going to be the supervision of going through the charts and kind of making sure all the things are done that need to be done. They're not bad. It's just those are just the things that it'd be nice not to have to do, but that's part of the requirement.
I guess everybody wants to grow, but if you had a sudden influx of, 50 new patients next week, what would happen from a business point of view at your end?
We would be much busier. That type of increase in patients would necessitate the question of what do we want to do, because we don't want to withhold treatment from people. We would probably be referring people to colleagues in the surrounding areas if people came in, because there's only so much we can handle. But if that did occur, we would be looking at the opportunity for, is that a sign that things are picking up so much? We need to hire more people. We need to do more, expand what we're doing. Again, that would be quite an opportunity to address.
And are there parts of the practice you've deliberately chosen not to grow or scale? And is there a reason behind that at all?
We haven't decided not to, but we have decided to not do as aggressively as in a fantasy world we might want to, because it just takes, there's only so many of us, there's only so much time. So I spend some part of my time encouraging my colleagues to think about this, to grow so that we don't have to. So I supervise residents from a local psychiatric residency program, encouraging them to consider moving in the direction of neuromodulation. And fortunately, so many of them are interested right now.
And have you ever any thoughts on group programs or digital tools or education to support patients beyond the one-to-one care in this sort of sector? Just because it's something a lot of people talk about, I just wonder if you have any thoughts on this.
The thing that I have contemplated with that, and some of us have been talking about it now for a little while, of trying to monitor the response rates digitally over time through some technologies. So there is some consideration of how we can incorporate such technologies in a way of maintaining more consistent improvement over time. Because that's one thing that things aren't built the way to do that. Since we don't follow everybody, we lose people to the community, and so we don't have a good handle on what's happening with that. And we've contemplated using some digital programs to pursue greater clarification of that.
If you had a magic wand and you could fix anything in the business tomorrow, what would it be? And I will assume that we've solved the problem of awareness through other means, but is there anything else that you'd love to be able to fix very quickly with the magic wand?
The magic wand, I would put myself out of business. I'd erase depression and OCD and anxiety from people. I'm not sure I mean that, because I think those types of things do serve a purpose as red flags for us in life. But I would certainly would want to minimize that in terms of the degree of difficulty it causes people.
And finally, where would you like to see the practice in 6-12 months' time? So just thinking ahead, 2026, 2027, where would you like to be in a year's time?
Would like for us to grow. We're looking at some different options in terms of how we can expand. If we maintain volume as we are now, then we're going to have more opportunities to do that. And so we might expand the size of our current locations. We might consider adding some locations. We might consider adding some different protocols. So expansion is just doing what we do, but doing it at a larger scale. And that's what I'd like to see over the next 6 to 12 months.
Well, we wish you all the best with that. And finally, if you were starting Nashville Neurocare again tomorrow, would you do anything differently with the benefit of hindsight and all that you know?
The one thing that I would do is, as you mentioned earlier, it is a business. I would seek out somebody who has more of a business mind as a consultant to help me think things through. I used people that I had known, but nobody that had the real more strategic vision. And I think that would have been helpful to begin with. And I think have erased some of the struggles we had along the way.
Wonderful. With that, I'd love to thank you very much, Scott, for joining us today. It's been a really interesting discussion, learning about the technique, your clinic, your approach, and some of the kind of business angles to running the clinic that you do. So thank you so much for joining us. It's been a real pleasure. Thank you.
Thank you, Dr. Greenland. It's been nice.